Hello, this is Dr. Stanley Lang. Welcome to this presentation. This is a continuation on a series of broadcasts that I've been doing on the subject of whole person health, which is integration of health of body, mind, and spirit. And the subject today is low glycemic eating in the elderly. So one of the questions that I receive frequently is how old can you, how old is there, one of the questions I get frequently is there an upper age limit on how old you can be to use the low glycemic eating strategy effectively? And the answer to that is that there is no upper age limit. In fact, it works well the older you get because it helps to reverse a lot of the metabolic defects that have slowly accumulated during the many decades of people eating too many high glycemic foods. So just to refresh your memory, low glycemic means foods that don't raise the blood sugar quickly and is generally referred to carbohydrates. So protein also is turned into sugar, fat is turned into ketones when used for fuel. So we use the term glycemic index to describe the effect of different carbohydrates on our system. And if the blood sugar rises quickly, we call it high glycemic. If it rises slowly, we call it low glycemic. And obviously there's a middle ground. So I saw a patient today who is in her mid-80s, and she's been diabetic for a long time. And about 15 years ago, she was tired of being treated by one of the local specialists and asked me to take over her care. And so I instituted a very low glycemic eating strategy, which is part of my diabetic reversal program. And she was able to completely wean off of all of her insulin in the process. Shortly thereafter, she ended up with an injury, ended up in the nursing home, and basically they refused to feed her the diet that had reversed her diabetes, and they gave her the American Diabetes Association diet, otherwise known as the ADA diet, which unfortunately has a lot of high glycemic foods in it. So she went in a poor control during that time, got out of the nursing home, went back to her home, and she resumed eating the strategy that we developed for her. And lo and behold, she got off of her insulin again. Recently, she had a major injury. She was in the hospital with major surgery and had extended rehabilitation for several months, during which time, of course, she was put back on the American Diabetes Association diet, which has high glycemic foods, and she was back on insulin. So since she's come back home, which I just saw her in follow-up today, she's back following the program that we have taught her, which is one of the foundations of my How to Reverse Diabetes program. And she is, lo and behold, off of insulin. And the point is that even in the upper 80s age group, this strategy works very well. If you're alive, then your chemistry is working well enough for low glycemic eating to help you. And low glycemic eating helps the body to heal itself. Now, the greatest, the most dramatic example of low glycemic eating would be the ketogenic diet. That's a completely different story. You can achieve pretty low glycemic responses to your meals by eating the right kind of carbs with the right ratios of protein, fat, and when you do that right, you're going to have very good control of your blood sugar. And I'm referring now to type 2 diabetics. These are adult onset diabetics. They don't have until the later stages when their pancreas burns out, but they generally don't have insulin deficiency. They have insulin resistance as the issue. And so basically this lady is able to reverse a lot of that by some simple eating strategies. Hope you found this helpful. God bless and have a good day.